어렵게 달려와 내일은 더 빛나지 당연 yeah. 내 삶은 shine like a diamond 괜히 해서 뭐해 걱정 I got no worries no.
Hey BX Beauties, question. Do you have a plastic surgery consultation scheduled? And are you wondering what questions to ask during this consultation? Well, stay tuned as we discuss the most important questions to ask a plastic surgeon during the initial consultation. My name is Aisha, and welcome to the Bracorriah X Beauty YouTube channel, where we are a cosmetic company that provides quality cosmetic products, give information on starting and running a business, provide plastic surgery support, and we're also here to provide empowerment to anyone in need. To hear more about our products and other helpful content like this, please subscribe to our YouTube channel. It is free and it helps a sister out. Y'all, real talk. I got 64 subscribers and I'm trying to get to at least 100. Help a sister out. Go ahead and subscribe. Even if you don't like the content, help a sister out. Go ahead and support our channel by subscribing. Now, you know what procedure you need or want. You've done your research and you've narrowed the choices down to maybe your top 3. You've also now scheduled your initial consultation. And now what? Well, we're going to talk about a few things to consider and some questions to ask when you are preparing for your initial plastic surgery consultation. The first few things to consider. Do your research and bring a list of questions with you to your initial consultation. Plastic surgeons actually expect and they welcome this because it ultimately shows that they have an informed person who's not just making a spontaneous decision and they've actually thought about what they're getting ready to do. I also recommend that you watch my previous video, Researching Your Plastic Surgeon. I'll link that video down below in the description box, but it ultimately gives really good information and some resources on how to actually research your plastic surgeon who are both located within the United States as well as internationally. You also want to understand your goals and what you're looking for. Many of us go to these consults and schedule these appointments and we have no clue what we're needing, looking for, or wanting. Knowing what you're looking for and understanding your own needs will just help the surgeon understand how to best offer services that they can provide and determine if they truly can meet your needs. Make sure that your consultation is not all plastic surgeon driven. Ask about the other team members that you'll interact with. Determine how they'll support you in your journey and ensure you like the full team, not just the plastic surgeon. Your reality is these support positions like the surgery coordinator, the anesthesiologist, or the scheduler, those people, they can actually make or break your surgery experience. And although it doesn't have to be as thorough as the surgeon, you want to inquire about them as well. You also have to keep in mind, there are some standard questions that you'll ask for all procedures, and there's also some questions that should be asked strictly based upon the surgery you're preparing for. Lastly, don't feel bad about asking every single question on your list. Heck, this is a big decision, and your life depends on you making an informed decision and finding a team you're confident in. So trust me, you can go into full interrogation mode if you want to. But keep in mind, you can't trust the process if you don't trust your plastic surgeon and their team. So now I'm going to quickly move through some questions to ask, and they're in no specific order. Do you complete a physical exam during the initial consultation? We've seen some situations where the surgeon says they only do virtual consults or they don't do physical exams. And y'all, trust me when I say, you want to follow our girl Beyonce's advice and say to the left, to the left. Like you want to exit stage left expeditiously, like ASAP. How in the world can you accurately tell me how you can fix my fat if you won't bother seeing how my jelly roll? Like, for real, who does that? And if you're somebody who have had plastic surgery without a physical exam or strictly through a virtual consult, please, I beg you, comment down below. Let us know how that worked out for you. Inquiring minds really do want to know. And in all seriousness, you want them to do a physical exam so they can perform a thorough assessment of your needs and you can discuss your medical risk and any options they can provide. This physical exam also helps you start building a rapport with this surgeon. And that's something that's going to be very important throughout the process. Are you board certified? Now, I can see all through the camera, some of y'all probably looking like, well, what does it matter and what does it mean to be board certified? And what does board certification mean? Well, it means that this surgeon has met the criteria according to the board in question that says ultimately this surgeon is practicing or has the tools and the knowledge and the understanding to practice at a higher standard. A little inside tip from one of your fellow clinicians. Sometimes you have doctors who are board certified in other types of random specialties, maybe dermatology, maybe something else, but yet they're doing plastic surgery and they're advertising that they're board certified. When it comes to getting plastic surgery, you want to ensure that that plastic surgeon is board certified in a plastic surgery specialty. And typically, the gold standard is the American Board of Plastic Surgery and Reconstructive Surgery. How long have you been practicing? What's your specialty? And what surgeries do you perform? You also want to ask for a general summary of their technique. Some people may say, well, why do I care about their technique? Trust me, technique matters, and especially when it comes to preventing scars and your recovery. You also want to know how many procedures they do in maybe a year, a month, and for sure a day. This gives you information on their experience level. And trust me, y'all, in my clinical practice, I've seen some doctors who will overbook themselves, which can lead to exhaustion later in the day and just overall poor care. So really, y'all, you want to make sure you ask about how they're booking themselves and what their experience level is. You don't want a surgeon who is so green, that they ain't had enough surgeries under your belt and don't have a lot of experience. But then you also don't want to have nobody who, you don't want to catch one of those old heads who basically just have not updated their technique. So you want to make sure you inquire about that. The other thing I think about, now, personal preference, but I always try to be the first or the second surgery of the day. Now, this may be my crazy thinking, But in my mind, it's like I've probably been starving all night. And the faster I can get this surgery, the quicker I can go back to eating. Because really, I ain't trying to starve myself all night and all day. And then secondly, I think about like if I'm the first surgery of the day, who's to say you ain't coming off it now trying to work on me and you still sleepy and tired? So I usually try to stick with being at least the second surgery of the day. Because in my crazy little mind, it's like, okay, you done woke up and you done kind of found your grooves. The other thing when it comes to scheduling, and this is just my crazy little thinking. I definitely don't want to be the last surgery of the day. Like, I do not like to be the last surgery of the day. Like, I don't want you operating on me and you all tired. You done been on your feet all day. No, baby, it just don't work that way. So I try not to be the first and I try not to be the second. For me, or the last. For me, the second surgery usually is my preference. So, little inside tip. Where and what type of facility do you perform your surgeries in? Is it in your private office? Is it an ambulatory or a day surgery center or a hospital? And this is important for several reasons. If you're having a complicated surgery or if something goes wrong, you have more of a response team and support in a hospital in comparison to the support you may find in other settings. The other reason you want to know this is because it absolutely affects your cost. Having surgery in a hospital is the most expensive in comparison to the other settings. And if you have to continue on, having surgery in a hospital or even a day surgery center can be more pricey than having surgery in a private practice that also has a connected surgery center. I've seen that these days as well. I've seen some plastic surgeons who have their own practice, and attached to their practice, they've also built in a surgery center. In those situations, it just allows the plastic surgeon to provide more of a continuum, an experience. You know, it's their way of controlling the full customer experience. So, and it saves cost, you know, because it's all connected. What is your revision rate? You have to reasonably understand that revisions are inevitable. But you can get an understanding of how often they're needing to do revisions. If the surgeon is always needing to do revisions, then this just may give you some insight into their technique. You also want to know how they handle revisions. Do they charge for revisions? And y'all know me, I'm always going to ask about free. Ain't nothing different with plastic surgery. Like, seriously, with all my doctors and with any surgery I've had, I make a point to say, Doc, can you tell me what revisions are free and what revisions are not free? Because I got to make sure that I cash in on some of them free revisions when I can and as it's needed. Like, yes. So make sure you ask about those revisions. What is your complication rate? How often do your patients experience complications? And this again gives you insight into their technique and their assessment abilities. Is it a situation where everybody is a good candidate even when they're not? Or is it a situation where they're not adequately preparing their patients or assessing their patients? And just like the revisions, complications can just be a part of your process. but you want to know how complications are handled. And discussing complications will also provide a great opportunity to discuss the risk versus benefits to getting this procedure. What are your surgery prerequisites? Like, am I a good candidate for this procedure? Sometimes you can be declined for a procedure based upon your weight. Maybe your BMI is too high, or maybe you have some other medical diagnosis that automatically increases your complication risk. What pre-surgery tests and labs are required to determine if I'm a good candidate for this procedure? Sometimes people are required to get labs, maybe an EKG or some other type of medical workup before their surgery. And as with any surgery, you're usually required to have your primary doctor complete a comprehensive history and physical within 30 days of your planned surgery date. There's nothing different with plastic surgery. Unfortunately, sometimes people are told no, they're not a good candidate for the surgery they're wanting. And I know this is disappointing, but please look at it as this surgeon has a moral and an ethical obligation to abide by. And their decision to decline your surgery could potentially be life-saving for you. So with that said, you're always welcome to get a second opinion at any time. Even if they do accept you as a patient, you can always ask about alternative treatments. And even if you question if it's a situation where you're just all out questioning the surgeon's technique or what they're saying they would recommend you get, you can always get a second opinion. You know, if you're going in for a tummy tuck and they're saying you don't need muscle repair, but you feel like you need muscle repair, you can always go get a second opinion from another plastic surgeon to see is muscle repair actually recommended? And chances are, if all your first and second and third opinion surgeons are saying the same thing, then you can trust that that first surgeon you saw was guiding you appropriately. What type of recovery should I expect with the procedure in question? And although everybody's recovery will be individualized and unique to you, you still want to ask, what is the typical recovery time for the procedure in question? What is the recovery or post-surgery visit schedules like? And are the follow-up visits included in the cost? You want to make sure the doctor has a follow-up visit schedule, and most times it truly is included in the cost. And this just helps ensure that you're recovering appropriately and you're able to timely respond to any complications you may develop thereafter. For the procedures I've had, my surgeon typically saw me weekly for 3 or 4 weeks, then at the 3-month time period and at the 6-month time period. And really, I mean, he knew that I was a nurse and I was healing so well that we just didn't schedule, a 1-year follow-up because I still was healing very well. And he understood that if I saw any complications or if I had any questions, I most definitely would come back in. And just keep in mind, the frequency of your visits really should depend on your recovery and your healing journey. If you're experiencing complications or if you're questioning your recovery in any way, then they should be willing to see you more often. And again, this should be included in the cost. You also want to ask about any recovery items they may provide. I know some surgeons provide compression garments, fajas, compression bras, and so much more. So just ask, what is included? What will they provide? And if they don't provide any recovery items, ask about maybe a recovery must-have list that they have. Ask about any educational information and brochures that target your procedure. You can never have enough information on the procedure you're seeking. Do they have a surgery prep list that'll help you prepare for the surgery? I know when I went to my initial consultation, they had a surgery prep list. That surgery prep list included important items I needed to have after the surgery. It gave information on what my surgery was like, as well as the recovery. So ask about that. What does the discharge process and instructions look like? Again, when I went to my consultation, as I was there in the consultation, they also gave me all my discharge instructions just so I had an understanding, again, of what post-surgery recovery would look like. And this question truly is an important one because it gives you insight on how well their discharge instructions are. And we've seen moments where they send you home with no instructions, and you get home and everybody is clueless. From you, your helpers, you doped up on medication and still under anesthesia, make sure you understand what their discharge preparation is like. And I talk about that in another video that I'll make sure I link down below in the description box. You also want to know, what meds do they provide or do they prescribe after surgery? Sometimes we see pain meds, antibiotics, muscle relaxants. Sometimes we see anticoags like Lovenox shots and things of that nature to prevent clotting. Again, your response to that question will depend on the surgery you're getting. How do you manage post-surgery pain? Most times they give pain meds during the procedure and then right before you leave to go home. But this is another question that you want to make sure you ask about. You don't want to get home just to find out that your pain is poorly managed due to a regimen that's insufficient. So you do want to ask about pain. What type of results should I expect? And are the results temporary or permanent? And how do I maintain my results? Now, I probably should have mentioned this first, but please do not forget to ask about cost. Many surgeons do consults for free at no charge, but you also have some who do charge a fee for just having a consultation with you. So you want to ask about cost. If I can sit with cost for a little bit longer, the other thing you want to ask about is, how much do the surgery cost? How much will they charge? And most often you'll see two charges on your quote. One for the actual procedure, and then you'll see another one for the surgery center cost, which is usually charged based upon the time spent in surgery. But when you're getting this initial quote, they usually will estimate on the basis of how long the surgery takes. So with my procedure, they estimated 2 to 4 hours. So on my quote, I could see how much I would be charged if I spent anywhere from 2 to 4 hours in the surgery center. You also want to ask about any discounts the surgeon may give. Again, sometimes surgeon will give a discount if you're getting multiple surgeries. So ask about it. For my procedure, I was getting, I had multiple procedures. So they charged me full price for one procedure, and then the subsequent procedures that I was getting at the same time, they gave me 10% off. So ask about it. My surgeon also gave a discount if I paid in cash, which y'all know I took advantage of. So again, another something to ask about. If you pay cash, will they give a discount? You also want to ask the surgeon or the coordinator about any payment options. And you also want to ask the surgeon or the coordinator about any payment options you may have and the deadlines. You want to ask about the deposit amount and the due date of when the final payment will be due. And that's only if you find a surgeon who will allow payments. I know some will not. Most times, payment is due like 2 to 3 weeks before your actual surgery date. But again, a great question to ask about. I would also ask about refunds if you need to cancel or reschedule your surgery. What is their policy on that? You never know when unforeseen occurrences will arise. And the last question, which is certainly a biggie that we often wonder about, what is your technique to minimize scarring? Minimizing scars actually starts with a surgeon and depends on how much manipulation and trauma is endured throughout your surgery. It also is dependent upon how they close that incision. So you want to make sure that you're asking the surgeon about their technique to minimize scars. It's also important to remember that age, genetics, and even just time really do play a part in scar healing. Inflammation within your body also plays a part in how your scars heal. The location of your scars make a difference and how noticeable they are, and is something to discuss with your surgeon. What locations do they favor that help minimize the appearance of scars? And location is important because there's parts of the body that endure different amounts of tension. Areas that are prone to higher levels of tension can result in more textured scars, which can be wider, thicker, and more raised, such as what we see in hypertrophic scars. And keep in mind, Black people, Hispanic people, and even Asian people are among those who typically have more textured and darker scars. You should also ask your surgeon, what type of treatment do you recommend for scars post-surgery? Many recommend the usual combination therapy, which is typically compression, tape to reduce tension, and when the incision closed, scar creams. And it's important to remember that just because the wound is closed doesn't necessarily mean it's completely healed. It still does require attention to ensure it heals from inside out and is aesthetically appealing. Now, I have to take a moment and humbly throw in a shameless plug. Yes, I am. Our Bracorriah X Beauty Scar and Blemish Refiner was made for people who have post-surgery scarring. We've developed an innovative scar cream that is inclusive of ingredients that have been clinically proven by science to improve the appearance, color, and feel of your scars, to reduce the symptoms of your scars, to soothe your skin, and to speed up wound or incisional healing. Our all-in-one scar cream can also save you money by not having to buy multiple scar care management products. And trust me, I know how it is to purchase a never-ending list of creams and oils and vitamins and supplements. Trust me, I know how it is. And if you haven't heard about our scar cream, please visit our website at bracorriahxbeauty.org. Our scar cream is silicone based, and silicone is the gold standard for treating scars. And we formulated it with a heavy focus on anti-inflammatory ingredients that help with reducing inflammation to the area and reducing the symptoms of scar development like itching and bruising and swelling and just that generalized discomfort we sometimes see. It has also been formulated with a heavy focus on addressing the hyperpigmentations and the discolorations we see with scar development. And most importantly, one of the areas that I'm most proud of, it is protein infused. Our formulation is originally developed and it is unique to the cosmetic market. You don't have any other scar creams that have been made with a heavy focus on protein supplementation. Your body needs protein to help build and repair skin tissue. And protein just also helps fight infection and carry oxygen throughout your body. When you have a wound that's healing, you have to increase your protein intake, and why not do it topically? And that's how our product is different. It offers all needed ingredients that further promote and have been clinically proven by science to speed up wound healing through protein additives. Like, you will not find another scar cream out there that is an all-in-one winning combination and is protein infused. And that's why this is patent pending, because it is an original combination. One of the other good parts about this scar cream is it's very low maintenance. Like, you put it on clean skin 2 times a day and go on about your business. It has a smooth, soft feel. It dries quickly, has no odor, and it can be applied to your face or body. And it's also great for people with other skin conditions like eczema and acne-prone skin. Trust me, I've been a nurse for almost 20 years. And one of the things that's different about all of our products here at Bracorriah X Beauty is they are designed to meet the clinical and cosmetic needs. So yes, you no longer have to neglect your acne or your eczema. We understand that your skin needs a little bit of additional attention. Guys, trust me when I tell you, we have a great product that we absolutely stand by. And we feel confident that it'll improve your scar healing if used consistently. Now, the last little thing I'm going to mention before I head out, we pay a lot of money for our surgeries. And why sell yourself short on a cheap, ineffective scar cream? Invest in quality. Make sure that you purchase a scar product that will ensure you heal in the best way possible. Like those ineffective, cheap scar creams and scar regimens, they just won't cut it. And really, I tell people, you get what you pay for, and sometimes the cheap come out expensive. So consider purchasing our all-in-one. You don't have to go out and buy the bio oils and the biocorniums and, the vitamin C and the vitamin E and everything else we typically are out here buying just to manage our scars. You get this one product that is inclusive of everything you're seeking in those products that you're buying separately. With that being said, make sure you visit and purchase on our website, BracorriahXBeauty.org, and subscribe for 10% off at checkout. My goal is to make useful content that you're interested in. So let me know what you'd like to hear more about. I hope this video was helpful. Share in the comment section, comment down below, share any other questions you feel we should be asking when we're planning for our initial consultation with a plastic surgeon. Maybe it's something we haven't mentioned here today. What do you think about the questions that I gave and I spoke about? At the end of the day, I absolutely enjoy hearing from y'all. Even if it's just to say hello, comment down below. I thank you and I appreciate it. Again, I hope this video was useful for somebody out there. Thank you for watching. Be easy, be beautiful, be blessed, and be you.
I got no worries, no. I got no